Hi, I'm Jordan Rubin, and welcome to Ancient Medicine Today, brought to you by DrAxe.com. Today, I'm with integrative medical doctor Lee Aaron Keneally, and we're going to talk to you about something that you need to hear. Whether you've been diagnosed with cancer, if you have a family history of cancer, if you have loved ones going through cancer, maybe you're a survivor and trying to prevent cancer recurrence, this program is for you. And I would wager to say, Dr. Keneally, that any autoimmune, inflammatory, debilitating, incurable disease can benefit from the information you're going to learn today. And now we see you in a lab coat and people come to the doctor for lotion, potion, pill, etc. But you're going to give information that I would say is much more universal in its ability to heal than anything you consume orally or intravenously. Wouldn't you say that?
Yes, exactly. People will ask me, Dr. Keneally, what is the single greatest thing that I can? And as Jordan said earlier, we're just not talking about cancer today. We're talking about any illness. Let's look at high blood pressure. If you're more stressed, your blood pressure is going to be elevated. If you have an autoimmune, there's a stressful emotional component to every disease process. And I would say you want to begin and end there. And none of us really think about it from the time we're born. And actually this starts way before the time you're born. We inherit the DNA of our heart and our emotions from 4 generations. And then we're born, and then we're exposed to the entire environment, whether it's our mom, our dad, our teachers, our relatives, and everything, about the emotional side of things, not just the physical side, but the emotional, spiritual side. And that's what our thoughts, we already know we have thousands and thousands of thoughts. And what kind of thoughts are those? And how is that directing the traffic, the information in the cells in our body? And it is probably the single most greatest thing you want to spend time and energy on. A lot of it we can't do it by ourselves. Sometimes we need a coach. You want someone who's got an action plan. When you go see somebody, whether it's a doctor or you go see someone who's going to be an emotional, spiritual counselor, you want someone who's got an action plan, not just someone who's going to listen to you talk, because that's not good. There's no action plan. We need someone who's going to give you the tools to create the emotional peace and harmony that you need.
Well, what if I told you that the secret to battling cancer or other diseases is between your ears? That's right, you may have cancer, but cancer does not have you. Insert, arthritis does not have you. Autism does not have your kids. Heart disease does not have you. Lupus does not have you. Fibromyalgia does not have you. How to defeat cancer and other diseases with your heart and your mind. The Bible talks a lot about this in Proverbs, particularly. It says that joy and really a good word is like good medicine, but a downcast spirit, depression, anxiety, dries up the bones. Another verse says, anxiety in the heart of a man weighs him down, but a good word makes him glad. And we absolutely know that as a man or woman thinks in their heart, so are they. So we're going to talk about something that is beyond food, beyond supplements, beyond treatment. We're going to talk about how the battle against cancer could be spiritual and emotional in a much greater way. And Dr. Keneally, I have counseled hundreds of people dealing with cancer and other illnesses, and I usually can tell within one 20-minute session who's going to conquer and live and who's going to suffer and die. And so we're going to talk about some of your top tips. I'm going to share something really, really cool that I recently experienced with someone, a miraculous result. So miraculous that the doctor, of course, said we were wrong, you never had cancer in the first place. That's actually mildly frustrating, but wonderful, right? When the doctor says, oh, we were wrong, you never had cancer.
Right.
But wait, you were going to treat me for cancer.
Yes.
Anyway, it's all good, but let's get started. You may have cancer, but cancer does not have you. How to defeat cancer with your heart and mind. And by the way, if you know anyone who's dealing with cancer or a debilitating disease, Dr. Keneally, I would say that there are other diseases that are close to evoking the same kind of fear. Thinking of scleroderma, myasthenia gravis, ALS, multiple sclerosis, diseases where you literally see and understand what's going to happen. Alzheimer's and Parkinson's, the fear is incredible, fear of losing your mind. So if you're dealing with a disease and fear's got a hold on you, this program's for you. Dr. Keneally, what I've noticed is cancer's a different illness than almost any other because it attacks your spirit first. And I've seen people they get diagnosed with cancer and they literally walk different, they look different. What was an elbow pain is now, oh my gosh, it's spreading. It's not a headache, it's spreading. You can choose to wake up after a cancer diagnosis, and literally it's almost as if the Grim Reaper's chasing you. I believe people take a diagnosis and either look it up online in terms of the prognosis. You have 95% of people die within 5 years. The doctor will tell them you have X amount of months to live. They program that in their brain, and I believe that many people die right around that time unnecessarily. So I want to get started. See, here's a big one. So you have a clinic that helps people battle cancer in an integrative way, using the best of Western and Eastern medicine, as they say, the best of holistic and conventional,
complementary
standard.
approaches,
Yes.
right.
And so one issue, and I'm sure you realize this, that people have when they come see you is they get intense pressure from their family who are not as educated on integrative medicine to do something differently, or you can even be threatened by someone. In today's day and age, if you have a child with cancer and you don't go through standard care, you can have Child Protective Services called. So how does somebody who wants to take a natural approach to cancer educate their family so that they don't get that horrible pressure or even condemnation? Almost they're being cursed by their family saying, you're crazy, you're killing yourself. You have to hear this, right?
Yes, you're absolutely right. Now, most of my patients know that I practice an integrative approach using the best of Western technology and complementing that with all what I call the new allopathic medicine. Chemotherapy, surgery, that will all be extinct very soon, believe it or not. And so, because there are so much on the horizon, so much, and we'll talk about a little bit about it today. But if I have that, first of all, I encourage you to bring the loved ones with you to the appointment, because our job is to educate you and empower you and help you understand the science and methodology of everything we're doing. Because believe it or not, there's a lot of science. There's hundreds of thousands of articles on using natural medicine, complementary protocols, whatever you want to do, whether it's acupuncture, your food, different kinds of treatments. There's actual science to all of this, okay? And medical doctors are learning what we call functional integrative medicine more and more and more. I just interviewed a girl recently, a new lady doctor, to come to my office, and she said, oh my goodness, you wouldn't believe all the doctors. There was a doctor that basically sees patients in the hospital every day, because they have a hospitalist now. And he said, she goes, well, why are you here? She goes, well, because we're not getting patients better. That is what is going, that's the state of affairs in medicine
Well,
today.
I have to interrupt you because I think this might have been missed. You said it pretty quickly, but you said chemotherapy and surgery. In other words, the standard care of cancer will be obsolete.
Yes.
And I've often said that we're going to look back on this day and age of oncology as the dark ages of medicine. We say today that bloodletting was murderous.
Right.
Frankly, bloodletting helps a few people, but there are
It does.
some cancers where chemotherapy works in less than 5% of the time. So I think it's important. Dr. Kenneally, you're a board-certified medical doctor, right? And you're saying that the, quote, standard care, which is often surgery, and by the way, I think you would agree, surgery in debulking the tumor can be beneficial in many cases. But when it comes to chemotherapy and radiotherapy, there's a lot of issues. And I've seen people from head, neck, and throat cancer experiencing horrific treatment. And we've heard, and you've probably seen, I've seen people with abdominal cancers with horrific side effects. And I'm not just talking about during the treatment, I'm talking about
The entire
debilitation,
time, yes.
Cancer of the urinary tract and the reproductive system. I mean, you're literally trying to destroy a little area and you're bombing an entire nation. So I want to make sure everybody understands, Dr. Kenneally's not saying don't undertake conventional care, but she's saying that there is so much on the horizon that some people, such as Dr. Kenneally, already know about, that it will cause the way we treat cancer today, which is born out of the chemical revolution, will be obsolete. So we're going to learn about that today. But right now we're talking about how to educate a loved one on taking a natural approach, because again, I've seen people be bullied by their family, called crazy. They call the doctor a quack. I mean, this is something that many
Really
people go
happens.
through.
Yeah, and so I tell people, look, I want them to come with the patient to become educated about all the different options, because we're a team of 7 doctors at our clinic, and we're doing conventional medicine. Okay, so that means whatever blood work, whatever scans that we need to do. Sometimes we need to do scans to figure out the enormity of the situation. And yes, as Jordan said earlier, debulking and getting rid of tumor burden is very, very important, but how we go about that is important. But cancer, from one cancer cell to tumor, takes 10 years, 10 or 12 years, depending upon the size of the cancer. So that means that, first of all, we all need to be thinking about prevention, because cancer is 1 in 2 men, 41% of females. So it's not like we're all in this together. So our brother, our sister, our family member, cousin, employee, whatever, we all have this in this together. So we need to, prevention doesn't sell, unfortunately, because people aren't worried about the headache or their autoimmune problem or any kind of problem until they have it. But we've got to change this, and this is what these programs are all about, is to change the way you're living so the outcome is different. But when I tell people, so your family member is telling you that eating well is not going to help you? Okay, now come on. Everything shows that, and now more and more doctors are telling us that sugar is not good. I just had a patient last week that their doctor said, oh yeah, you got to get off sugar. He was a completely conventionally trained doctor that's going to do surgery on her for ovarian cancer, and he said, oh no, you definitely have. Well, that's unheard of. We already know that lifestyle environment is what is causing cancer today. So what are you doing? What are you doing, regardless of what everyone is telling you about? But what are you doing? How did you get into cancer? How did you get the diagnosis of cancer to begin with? You must do some self-reflection of how you are living, regardless of any scientific study. Let's say we're going to grow crops. Well, you have to have the right soil, you got to have the right water, we have to have the right sunlight. I mean, no one's going to argue with that.
Well, but you make an interesting point, because I can attest firsthand to the cancer machine or the cancer monster, but also the agricultural monster. And so it is a great parallel.
Yes.
But if you think about it, if you try to become a farmer today and you go through the normal educational process, you are essentially doing the equivalent of cancer treatment to your soil.
No,
but I understand what you're saying.
I know what you're
It's really, really important. Here's something that I've always said. You got to love your family. But if you're going through cancer, for example, if you have children, if you have a spouse, we recently had a program, Dr. Keneally, where we had a 12-year-old named Austin who has a sprouted nut business that was started with his father, and his father just passed away from cancer, Dr. Majors, and he was an amazing advocate for cancer, writing the book Cancer Killers. So when you're dealing with this, it's not just about you. It is about your family. It is about your responsibility. It's all encompassing. But here's the bottom line. Love those you tell about your disease, but if there are people around you that are telling you that your treatment option is going to kill you, hurt you, you're crazy, you need to put them out of your life for a while. And I know that's pretty harsh, but
it's
when
true.
you're dealing with cancer, you surround yourself with practitioners and people that believe in you and are with you. And I've seen so many times where people are torn, whether it's a mom who has 2 adult children. One of them's for complementary medicine, one is against it. You want to please, but bottom line, when you make your decision, and Dr. Keneally helps, I'm sure there are people that come in that you determine are not candidates, or they determine they want to do whatever they want to do, and they don't believe in your methodology,
and that's
they
okay.
go do their thing.
Yeah, and that's okay, because I tell people we always want to do what you believe in.
That's it. That's so important.
Because so much of how the outcome is what you believe. But I at least tell people to learn about the entire cascade of things around you that you can do, whether it's eating, the water, the sleep, the nutrients. But I'll tell you, the frontiers of medicine, we've got to get this in, is once you have something growing in your body, a millimeter, just one teeny tiny millimeter, it's releasing circulating tumor cells and stem cells. Now, guess what works on that? Not surgery, not chemo, not radiation, only natural agents work on the circulating tumor cells. And that's what's responsible for 95% of metastasis and death. So you can all day long refuse to do, do the standard of care. I go, okay, let's say you're going to do the standard of care. I have a lot of patients, Jordan, that they've done the lumpectomy and they've done the radiation or the chemo or whatever combination thereof. And then I'm like, okay, first of all, then what did you change to change your lifestyle and get yourself out of this cancer? But more importantly, did someone check your circulating tumor cells? Circulating tumor cells are the new frontiers of medicine. They just came into the oncology books 2012. They said that you have remission and or cure when your circulating tumor cells are zero. Now they have blood tests all over the world that are measuring circulating tumor cells, but very few doctors know about circulating tumor cells and stem cells. But that is what's responsible for cancer coming back. Forget the lump or bump. Once a lump or bump is gone, now you've got to know what your circulating tumor cells are.
So if you're watching, we're talking about how to defeat cancer with your heart and your mind, but if you're saying, I want to defeat cancer with integrative medicine, at the end of this program, we're going to give you information about how to contact Dr. Kennealy's clinic. She's in Southern California. You may not be able to get to her clinic. If you want to, you can certainly make an appointment, but we have a great offer at the end of the day. We'll share with you Dr. Kennealy's brand new book, The Cancer Revolution, which can help you at home and or with your own integrative doctor make the right choices. But you said circulating
tumor
cells,
Yeah.
circulating tumor cells,
Yes.
CTC.
Right.
If your
CTC.
doctor doesn't know about it, have them watch this program. Go ahead and copy this link. And by the way, if you know anybody who has cancer or somebody who is concerned about developing cancer, you want to go ahead and share this program with them because it could just transform their life. And remember, I'm going to share with you a secret that I believe transcends all of food, all of supplements, all of conventional medicine, and it's the #1 way that you can defeat cancer before it has a foothold. All right, here's another important question which will lead to this key that I'm talking about. And I've heard this many times, and occasionally it's true. Dr. Kennealy, I'm doing everything I should be doing in regards to diet, lifestyle changes. However, I'm still not receiving results. What now? And I'm sure the first step is, what are you really doing? Because people's understanding of doing everything right may not be exactly your understanding. But if a patient says, I'm doing everything and not getting better, what do you say?
Yeah, well, it's interesting. About a month ago, we have a medical conference every Wednesday at my clinic discussing cases. And we were discussing with another doctor in Texas who runs a laboratory that does circulating tumor cells. And we use in our clinic, and we use the standard of care in our clinic, is you are in remission and cancer-free when your circulating tumor cells are zero.
So not when a scan shows zero,
yeah,
not when an ultrasound shows zero, not when a blood test
Correct.
is in range, when
It's
the circulating tumor cells are undetectable.
Right, exactly. And so there's blood tests that are, they're done all over the world. And so anyway, we were talking about this subject about like when patients, because what happens when we do this test, Jordan, it tells me all the natural substances. So what they do is they put the circulating tumor cells in a dish, and then they say how much does vitamin D work, C work, curcumin work, resveratrol work, indole 3-carbinol.
So cytotoxicity, they're measuring
exactly.
cytotoxicity.
They're measuring cytotoxicity, which is cell toxicity. And so you can tell what things work. They check 50 different substances.
Wow, that's amazing.
Okay, so you can tell. So we tell the patients, okay, I rotate them on a regular basis once a month. Now, again, that's not the only thing we do. Obviously, we're changing lots of other things, correcting all their blood imbalances, et cetera. And then the circulating tumor cells would give the natural substances. And I've done this. On a rare occasion, I've seen several patients not decrease their circulating tumor cells. So I always ask them, okay, what are you doing for yourself emotionally and spiritually? Because we don't always know what our roadblock is, Jordan. We don't always know what it is. We may be living life thinking we're doing everything, thinking we're happy, but a lot of times we need an outside person, objective person, to actually evaluate what's going on with our emotional quotient in life. And so I find that once people, you mentioned about a person that that you treated or helped intervene. That once that you treat the patient emotionally, now in our practice, we have two different methodologies we use. We use an in-person treatment where we talk to the patient to understand, or we use something called EVOX. EVOX is very fast. And what they do is the patients talk about themselves, and your brain is displayed on a map, and it tells us where your emotional conflicts are. And then the practitioner is able to create a resolved emotional conflict of that particular person's issue. And it's very, very fast. And we find that those patients, like you said earlier, this patient, they're miraculous. They're absolutely miraculous. And so people's roadblock in not getting better is they have an unresolved emotional conflict, and they have too much anger and hatred and unrest and unforgiveness in their body that they can't move to the next step.
Absolutely. Well, I can tell you in my own personal journey, I made a decision to deal with spiritual and emotional issues. And I'm fairly young, but we store memories like a virus is on a hard drive, and all it does is get worse and worse. And so I literally spent 4 days going back through my history from my earliest memory of when someone hurt me or when I hurt somebody. I'm talking about I struck out a lot when I was in Little League, and as I was an 8-year-old, and my coach said, if you strike out again, I'm going to do something something bad's going to happen. To having a dance and getting turned down by somebody. I wouldn't really know much about that. I always make jokes about that, but I do know about that. All of us have had little things. I heard Dr. Keneally once, somebody was sabotaging themselves. They're brilliant, beautiful, and had every reason to succeed, and someone traced their issue back to a time when their mom gave their sister a lollipop and didn't give them a lollipop, and so therefore that memory causes them to believe that they're not good enough. But I do want to tell you something that's really, really important. This will, as I said, transcend any treatment you can undergo. And as I mentioned earlier, we're here talking about defeating cancer and other diseases with your heart and mind. But Dr. Keneally, I was with someone. It was a gentleman who was getting a routine exam, just a physical, and it led to some more tests, and ultimately he had a cancer somewhere near the hip. It was a cluster, and what they told him was, you need a surgery, and the surgery will cause you to likely need a catheter. Your urinary tract won't work properly. Your foot, I think it was either the right, I forget which foot it was, you'll have essentially drop foot. You won't be able to have circulation to your foot. You won't be able to walk without assistance. And that, among other issues, and you'll live a year. So in other words, this cancer is going to kill you. And this was a young man, he was in his 40s, had 4 children. And so I was doing a seminar and he said, can I talk to you? I think he called my assistant and said, can I meet you early and talk? His name was John. So he's there, he feels okay. That's the worst part. There's a lot of cancers that are diagnosed. You feel just fine until you're diagnosed, and then all of a sudden you start feeling sick. So he believed in fighting this spiritually. And as we were talking, and I usually pray, and I hope God gives me something to say to someone that would encourage them. And I said something for the first time that I've used since. I said, John, do you know the size of you know what the shape of your tumor? And he said, they say it looks kind of like a cauliflower. And I said, what do you do for a living? And I believe he was in construction. I said, now I'm not really handy and I'm not good at building things, but I encouraged John to build what he thought the tumor looked like out of clay. Because think about this, if you're diagnosed with cancer and every day you think you're getting closer to death, your time bomb is ticking. You got 3 weeks till you have to get here, and you mentioned on another program, oh, well, emergency, go get this now. If you don't start chemo in 2 weeks, you're dead. So he was getting pressured, and you start to count backwards from the 6 months or the 3 months. Instead, I said, it's important what you look at, what you visualize. So he built a clay model, and I said, every day rip off a piece of that tumor. And I said, and you put it in a place where you can see it, and eventually it goes down to nothing. I said, the other way you could do it is draw a picture of it, keep this day 1 here, and then draw another one with a piece out of it. See, we do the opposite. We picture it growing. We picture it spreading.
And every pain.
And so I got a letter from John, and this was, and Dr. Keneally, as much as I have faith, sometimes I have doubt, and I was very concerned about John. I didn't have a way to keep in touch with him, but I got a letter from him that a few months later, he went back in. The doctors were going to prep him sort of and look at the surgical option, which he wasn't really interested in, but they tried to scare him. And he said, Jordan, they tested, they looked, they think they misdiagnosed me. Now, he had gotten 3 opinions. And what they said was, we don't know what happened, but we think you were misdiagnosed in the beginning. Now, folks, I'm not telling you that everyone out there who has a tumor can build a clay model and rip pieces off and be well, but I promise you that the mind is much more powerful than you think, and the cancer machine is unwittingly setting us up for failure. And so if you're trying everything, whether it's conventional, integrative, or both, if you don't get your emotions figured out, if you don't forgive those that have hurt you, there are people, Dr. Keneally, that have been abused, a high percentage of people. They've been abandoned.
Yes.
They've never been loved. They've been put down, spit on, figuratively and literally. And I've seen people that change their diet and their lifestyle, but they're unwilling to forgive. My own grandmother, who lost sisters in the Holocaust, she would not forgive for what happened. Right. And so it's absolutely critical that you do something. When I was a child, and I remember this so vividly, I was watching 60 Minutes, and they had a story of a woman who was diagnosed with metastatic cancer. I don't remember where the origin was. And she, every day, spent time visualizing the tumors as carrots, and there was a rabbit eating the carrots. And she was completely cancer-free after a number of months. And so this may sound hokey pokey, but I guarantee you, chemo will be gone, like Dr. Keneally said, but these type of, you can call it visualization, you can call it positive thinking. I don't care what you call it, but it works, doesn't it?
Yeah, well, they keep records of miraculous healing, okay? And there's a great book called Radical Remission, and it's about these people that did exactly these things. And so if you, whatever you think and believe, that's what will happen. And there's life and death in the power of the tongue. And so we've got to all really understand so many people just don't understand just simple little things that we can do. But you're right, patients become their diagnosis instead of thinking the prognosis as being the cancer gone.
Absolutely. If people, for example, will go around saying they're a diabetic, or just a little bit of differentiation in your wording, I'm battling diabetes, or I have a diagnosis of diabetes, you are not a disease. You are not bound by something. Remember, cancer doesn't have to have you, even if you've been diagnosed with cancer. When I've gone through healings myself, including cancer, I made sure to speak things that were the truth, not things that were what I didn't want. And the funny thing is, people say, well, the truth is you have a diagnosis and the doctor said you'll be dead in 90 days. But I'm not dead right now. I don't feel dead. So why should I talk about being dead when I'm alive?
Right.
Folks, everyone's going to say, it's easier for me to swallow a pill than forgive somebody, my ex-husband. It's easier for me to eat radishes or take an Epsom salt lavender bath than to deal with emotions from my father when he walked out on me. But this is really, I think even they are calling it new medicine because the mind-body connection is absolutely critical. And I don't care who you are or what you believe, it works. And here's the best part. If you decide to tackle something with joy, if you speak what you want, what's the worst thing that happens? You encourage a few people around you.
Right.
You make people happier instead of going around moping and destroying yourself. I do believe this is critical. And that's what I think, in essence, the cancer machine, the oncology, I would say the specialty has become a bit heartless. Not heartless in that they want to kill you, but they've removed the heart from it, because that's what heartless means. And it's absolutely critical. You need to get the mental and spiritual component. What you say is truly what you believe. If you think that you're going to be rich one day, but all you ever do is talk about being broke, if someone around you doesn't know what you believe by what you say, then you don't really believe it, I would argue.
You become what you think about most of the time.
Well, and this third and very important question is probably going to dovetail and just expand on what we just said. What is the one characteristic, Dr. Keneally, that sets apart individuals that beat cancer versus those that don't. I said earlier, in a one conversation, I can usually tell if someone's going to conquer or if someone is going to wither away and die. So what is that one characteristic? This is huge, folks. We're on Ancient Medicine today. We're talking about how to beat cancer, the disease it's claiming. You said 1 out of 2 men. So here's a crazy statistic. In high school, if there was a thing at homecoming where there were 4 males and 4 females, by the age of 35 or maybe 36, 2 of the men had cancer out of the 4. And this was young people who were athletes, who were academic, and that's as of now. I wonder, well, later in prostate cancer risk, et cetera. So that's just crazy, and it's getting worse. So what is this one characteristic where you see somebody and you say, in my experience, I think this person's going to do it. They're going to beat it.
Right. Well, it's interesting. We talk about this because we take care of lots of patients, and probably 40 to 50% of our patients are patients who've exhausted the conventional medical paradigm. Everyone's given up on them. And so they come to us literally dying and seeking and desperate for answers. But what I find is the people who go, they come in, they're happy. They come in, they infuse happiness to everyone else. And they don't even think that they have cancer. No, I don't have, that lump's gone. It's all much better. I know it's gonna be better. But those people who are not stopped and roadblocked by their diagnosis are the people that do exceptional. The people who come in complaining and yes, there is no, I tell people we shouldn't complain. You can have a concern, but a complaint doesn't work. You complain, you remain. And so, but people who come in and they become obsessed with every single little gory detail. No, just go with the flow of whatever the doctors, the practitioners, therapists, everything. Just do it and follow through, but be happy and joyful and peaceful and make who you are contagious to other people. But I'm telling you, at the clinic, it's amazing. Everyone talks about how the patients who do well, they've decided to not be their illness and not to be controlled and owned by their illness. And they've decided they're going to live life. They're working. They're like, no, I'm not this diagnosis. And every time the patient goes, well, my breast cancer, my this, I go, no, the bad cells, the cancer. But that is changing the way people think. But I can tell you, so we all, but regardless, this can be applied to the way we live every single day. Whether we're working, whether we're a mother, whether we work in any job. Let's try to all make other people happy and be loving and respectful to the fellow man. That is what is so lacking today, is we're not caring and loving. This should be the care revolution.
Absolutely. And we are in a world where all of us have trouble. It's been that way from the beginning, whether it's financial issues, marital issues, other relationships, or health, and it truly can change. Why do we go around saying what we don't want to happen, spend 99% of the time worrying, and then it doesn't happen, but yet we've lived as if it does? The bottom line is, if you have cancer and you've been diagnosed with it, you have to have faith that a CT scan or an MRI or a PET scan determines something, right? It's faith to believe, because a lot of cancers you can't feel.
You can't feel
a lump in your colon you
can't
can't feel.
Exactly.
But you're having faith that the doctor who said you have a year to live, or WebMD you said it, you have faith there. Why can't you have faith that those who conquered, you could be among them? And that is so, so important. I want to mention one thing, and I know this isn't up on the screen, and hopefully our team on social media will post this, but there's a great video of a message I gave, and you can find it on the URL 2, that's the number 2, Hell with Cancer. The number 2, Hell with Cancer. So remember that, To Hell with Cancer. I preached a message at a church in LA, and the pastor had just been diagnosed with cancer himself. It was a very interesting circumstance. He invited me to speak, didn't know what I was speaking on, and he said to me, Jordan, I just want to let you know, I've been diagnosed with cancer. I'm announcing it to the congregation today. I hope this doesn't mess up your message. And I said, wow, not only will it not mess up the message, but I really think it is perfect timing. And it's just an important message on the spiritual side of cancer. Now, Dr. Kenneally, I know that people have listened to us about how to beat cancer with your heart, your mind, spiritually and emotionally. And if you're somebody who knows someone or is someone who's dealing with cancer, I highly encourage you to save the link to this video, watch it over and over again, share it with your friends, and make sure to like us wherever you're watching, whether it's Facebook, YouTube, or other places, because this is so critical. But earlier you said something about circulating tumor cells, and this was a mind-boggling statement, one of two that I think we need to reflect on. One is, in your experience, when circulating tumor cells are undetectable, that is when cancer is truly in remission, not when the lesion's gone, not when the spot's gone, not when the tumor's gone, not when the blood work's normal, but when the CTCs are gone. So if you want more information on what a circulating tumor cell is, where to get testing, to go to your local doctor and mention it, definitely check out Dr. Lee Aaron Kenneally's brand new book, The Cancer Revolution. It's available at KenneallyMD.com or wherever books are sold, certainly online booksellers. And if you want to see Dr. Kenneally and her team of 7 doctors in Orange County, you can also get more information on her website. Again, that's KenneallyMD.com. But Dr. Kenneally, people don't have to come to you to learn your secrets to defeat cancer.
Right,
so tell us a little bit about the Cancer Revolution
book.
Well,
the book was written to educate people about all the different facets of cancer. One, the cure for cancer is prevention. So I go through an entire chapter on all the things you can determine if cancer is brewing, simmering, or fermenting. So that is important. And I know we don't care about prevention, but today, with the statistics today, Jordan, as we've talked, people need to be concerned about prevention. Then, if you've been diagnosed with cancer, don't just look at your options of surgery, chemo, and radiation. You may need some of that, but you need to look at now how to prevent cancer ever coming back. It's not about the lump and bump. Once a lump and bump are gone, now you've got to make sure that you're cancer-free. And as Jordan said earlier, you're cancer-free when your circulating tumor cells are 0. And guess what? What other things matter? How you sleep, the water you drink, the foods that you eat, how much you detox, and resolving unresolved emotional conflict. And I address all of these things in detail with lots of references and tools for you to look in yourself. And it's packed with amazing juicing recipes, amazing food menus and everything, and all the reasons why, where, when, and how you've gone. If it took 10 years, there's a lot that each one of us need to analyze to figure out how we got into this diagnosis to begin with.
You know, I would say something, it's kind of a bold statement, but based on the statistics, 1 in 2 men, 1 in 3 women, and that 1 in 3 women is creeping upwards.
Yes.
1 out of 2.3 human beings will develop cancer in their lifetime, according to statistics. So that means if you have a mom, dad, sister, brother, son or daughter, grandparent, aunt, uncle, friend, you're going to know somebody. And you're going to know somebody you care about. So I would argue that having a book such as The Cancer Revolution on your bookshelf or available to you is probably a great thing so that you can arm yourself if you should be needed. I'm not saying have it in case you get cancer. What I'm saying is have tools for when you need them. When we buy tools, we don't buy tools only because we have a need today. We have a toolbox so that when this goes wrong, when that goes wrong. So I want to encourage you. Number 1, Dr. Kenneally's clinic. Now tell me, you mentioned the name of your cancer clinic off the air, but what is your clinic in Orange County? What's it called? And give a little bit of information on that if someone wants to come see you or one of your team.
Right. So we have the Center for New Medicine, and we treat everything from cold to cancer in that clinic. And then we have the Cancer Center for Healing. And our patients come from all over the world. We do Skype, we do phone consults, and I work with other doctors, other functional medical. That's what it's all about. Together, everyone achieves more. So all of us together, because I may know something that he or she may not know, and vice versa. But it's all about what? Getting you well and healed. So that means not necessarily one person has the exclusive opinion on how to get you well. Look at all your options, and we will give you all your options. I send people to Germany to get well. I send people to Japan to get. They do things that we don't do here in this country. And so we've got to use the world for the treasures of the universe to get people well. And you may not know about them. And so, you know, and our Center for New Medicine, we practice a lot of preventive, personalized medicine, okay? It's to get you optimal, all right? And then the Cancer Center for Healing is if you've been diagnosed with cancer, you want to find out, are you cancer-free for sure? Or we have a lot of our patients, they're stage 4 cancer patients, and the conventional medical paradigm said there's nothing else we can do. Well, you know what? There's always an answer if you don't look for it.
Absolutely. Well, there is something for everybody at KeneallyMD.com. The Cancer Revolution is a great book, whether you have cancer, you've been diagnosed and maybe you're in remission today, or you have a family history of cancer. Bottom line, folks, you don't just beat cancer with surgery, chemo, radiation, pills, potions, and lotions. The battle to defeat cancer starts between your ears, and I hope you enjoyed today's program. If you did, please share it. I can't think of a better, more universal way to bring healing to the world than to understand that what we believe, what we think, what we say, how we conduct our lives can be very much what we walk into tomorrow and our future. So on behalf of Dr. Lee Erin Keneally, the Cancer Center for Healing in Orange County, the Cancer Revolution book, check out KeneallyMD.com for more info. I'm Jordan Rubin for Ancient Medicine Today, brought to you by DrAxe.com. God bless you. See you next time.
Hi, Dr. Axe here. I want to say thanks so much for checking out this YouTube video, and also don't forget to subscribe if you want to get more great content on things like herbs, essential oils, natural remedies, and how to use food as medicine. Also, check out more of our content on my YouTube channel. Thanks for watching.